Our next speaker is Dr. Michelle HLADUNEWICH from Canada-Ukraine Surgical Aid Program, Sunnybrook Health Science Center, University of Toronto. She'll be speaking on Reconstructing, Casualties of War, Canadian-Ukrainian Surgical Aid Program.
Thank you. Thank you for having me. Mark, why would you not want Canadians? Wow, what an example. They wouldn't be excited if some Canadians wanted to come, but let's thank God it's the Ukrainians, okay? Yeah, we're just loading up my presentation. So I want to apologize for not being here yesterday. I was at the American Society of Nephrology giving a talk in Houston, and I was speaking on preeclampsia, so that's my first disclaimer. I'm not a surgeon. I'm actually a nephrologist, but I'm here speaking on behalf of our surgeons who couldn't be here today, and I go as an organizer and a perioperative medicine doc, and I spend time with them in Ukraine. So I guess what we're going to present, Mark, is kind of like the exact opposite of what you're doing by bringing people here, is that we're taking surgeons, and quite a few of them there, with the same sort of types of educational programs. Eventually it's going to load, right? Yeah, sorry. I could tell a joke. Should I tell a joke? No? No jokes? No, do it. Oh, I don't know. I'd have to think of something. But my jokes are probably more appropriate for after. All right.
In the meantime, does anyone have any questions?
You can start asking questions.
For Dr. Mims or for anyone else?
Okay. Well, maybe I can start giving a little bit background of our program. Really, the Canadian-Ukraine Surgical Aid Program is not actually, oh, there it is. Good? Podium, oh, there we go. All right. I can just advance this way, or? Working? Okay, great. Okay, so I've introduced myself, and I am speaking today on behalf of Dr. Ole Antonishin. I think many of you know him as a craniofacial surgeon in Toronto. Steve McCabe, who is a hand surgeon in Toronto as well. And I'm the person who manages the background care of these patients. So this didn't start with this war. So the Canadian-Ukraine Surgical Aid Program, which is sponsored by the Canadian-Ukraine Foundation, actually started going into Ukraine in 2014, right after the war, when the war actually started. Oh, what you doing here? Oh, it's not loading still.
Sorry. There.
Okay. So these missions started many, many years ago, and they were all over Ukraine. So Dr. Antonishin and his team would take a team of medical surgeons, nurses, the whole team, and go to different parts of Ukraine. And they did this for a really long time, and they did it very often. Every few months they were going through Ukraine, and then COVID hit, and we couldn't go into Ukraine. And as soon as COVID ended, then the full-scale invasion happened. So that required taking this sort of to the next level. I was going backwards. This thing is just really not really. There we go. So the objectives of CUSAP are to provide complex reconstructive surgical care to the victims of Russia's invasion of Ukraine, but also to provide medical professionals direct and remote surgical training through the Sunnybrook Ukrainian Surgical Education Initiative, which was also established in 2018 under Dr. Ole Antonishin. So when the war started, this is a little complicated because our funding organization actually, because there were lawyers involved, just like Mark said, was not super keen on us going into Ukraine. They didn't want us to take a large group of people into Ukraine because we tend to travel like a hospital in a box. So we actually set it up in Poland. And what we actually had to go through to set this up in Poland was really something else. So we found a hospital in Poland that essentially would give us their OR suite for a period of 2 weeks. And we would come in there, we would transport in 50 to 60 patients very severely injured from Ukraine, bring them to Poland, and we came there with these large medical teams to do it. So it was I have a Polish medical license. I didn't know I could have one. So all these things that needed to be put in place were really, really complicated. And we would bring like a full surgical team. We would bring craniofacial surgeons, plastic surgeons, microsurgeons, flap surgeons, hand and peripheral nerve team, orthopedic team, internists, intensivists, ER physicians, pharmacists, wound care, physio, OT, and computer modeling and prototyping. So we really brought a very, very big group of people into Poland. And you could see our successive missions, the size of which this grew. Like, it was a little bit insane. So mission 1 was a trial mission. Then by mission 2, by mission 3, by mission 4, by mission 5, we were bringing like 70 people. We were like a hospital in a box, but we were doing a lot of surgeries. So you can kind of imagine what this felt like for a Polish hospital to have this. Can you imagine if somebody at Sunnybrook brought in 70 people, took over half of our hospital for 2 weeks, and then left? It would be a very overwhelming experience. And our Polish colleagues could not have been any more hospitable. They were amazing to let us do this. We were in a tiny town called HLADUNEWICH, Poland, which is sort of closer to Katowice, and they would know we were coming. They would clear everything out for us. We had to figure out when all the Polish holidays were, because that's when they were on vacation, and that's when we would get full force of as many ORs as possible. And we would start in the morning at 8 o'clock, finish around midnight, 2 in the morning, and this would go on for days and days. But you can also see how this becomes a little bit less feasible. Like, there's only so many times a Polish hospital can host to this effect. So we wanted to go back into Ukraine. So in 2025, we did go back into Ukraine. So now our missions are back into Ukraine. And because we're in Ukraine, we can actually go with smaller teams because there's a lot of people around. Like, we could use the Ukrainian medical system. Like, one of the deals with Poland is we couldn't impact them. That's why we had to come as a hospital in a box, because they couldn't really help us at the time. They were managing their own hospital. They had their own patients. They just gave us the space. But in Ukraine, we're integrated with their medical team. Like, we're working together collaboratively with their medical team. So now we can come in with smaller teams, which obviously makes it a lot more cost efficient and would allow us to do more missions and see more patients. We can help more people when we're in Ukraine, because sometimes, you bring somebody all the way to Poland. Maybe they didn't need an operation. They could have just gotten away with more of a consult. Now you can actually do consults, because our Ukrainian surgeons are stellar. They know what they're doing. They've been doing this at bigger volumes than what we've been doing for some time now. But sometimes they just want to hear, what would you do in this case? And then they'll do it later. So that's opportunity to give these consultations is there. Now, we couldn't take very severe patients to Poland because one of the rules was we couldn't leave them in their ICU. So if something went wrong, so that really limited some of the people that would have needed a neurosurgeon, right? Like, we really couldn't bring them to Poland. We couldn't go back to Canada and leave a sick patient in a Polish ICU. So there was a lot of real challenges, and now we can do sicker patients because we're in Ukraine. The patients are at home, and it's much easier to work with the medical specialists. It's hard to get people out of Ukraine, especially some of our male surgeons. Now there's not a problem. They can come from all over Ukraine. They know when we're there, and we can train in much larger volumes and educate in much larger volumes. So this was our just most recent mission. We went to Luke's to do craniofacial. That's Dr. Oli and Tanishin. We did 44 consultations, and they completed 28 very complex craniofacial surgeries. And the limb salvage mission was in Lviv. We again did 44 consultations and 24 quite complex operations. So how we do this is basically, because Dr. Antonishin and these surgeons have been in Ukraine for so long, the cases come from Ukrainian colleagues. So we start with virtual consults first at home. We gather all their medical records, we gather their films, we gather their pictures, and we go through it and come up with somewhat of a surgical plan so we know who we can and who we cannot help. We'll do this 2 or 3 Zoom meetings as well as with the Ukrainian surgeons in advance before we go. And no matter how hard we try to plan that, every time we go to do our consults, it's still a bit chaotic. Like, we'll plan to see, this time we planned to see 28 patients and 48 showed up. So it's always like a little bit of extra, so those days are always very different, but that's okay. And we do these then very long consultations. We'll then meet with their Ukrainian surgeons so that we could develop an operation plan, because they're done, we're doing it with them. Everybody is working together on these surgeries. So that's one of the things where you can get around the hands-on part, because they're in their own environment and we could just be there to support them with all the hands-on surgery. The severity of the injuries are really you know, I know for you guys, or many of you are surgeons and doctors and you've seen it, but for others who maybe haven't seen it, it really is very shocking what we're dealing with the, you know, you've got a Kevlar vest and your torso is protected, but your face is not, and your limbs are not, and we're seeing some really, really dramatic injuries, and there's so many of them. And here's sort of one example of sort of just a mid-face defect. And, you know, of course, that they did get some surgeries in Ukraine, but it needs a lot more work. And, you know, you kind of, like, Ukraine's under, like, you're drinking from a fire hose. There's so many wounded people. There's so much to do that sometimes maybe one of these 12-hour reconstructive surgeries is not something that they can have the time for right away always. Like, you know, they can do them. They're very capable, but there's a balancing of resource that's happening as well, just because there's so much happening in Ukraine at once. This is just another example of a lower third of the jaw, and I kind of want to show you how he turned out. This is a very unfortunate situation where the entire lower part of the face was gone, the mandible was gone. So not only was this not all cosmetic things, it's also very functional because he could not speak and he could not eat. So I'll show you a little bit about how he turned out. So we come with a lot of equipment. There's computer modeling, rapid prototyping. I don't know what this is. I'm a nephrologist. I just get excited when the electrolytes are off and these guys. But what I've learned about my surgical colleagues is they're very impressive people that can build things out of nothing, and it's really amazing to me. And they do some really, really beautiful work. And then when they cause hyponatremia, I'm all over it. I'm in there like you have no idea. I'm so excited. So, all right. The limb salvage are equally, you know, very sad cases. This was a very lovely woman who was, her home was hit by a missile, and she had a crush injury, and both of her legs were broken. They suggested, you know, of course, she could, you know, maybe benefit from amputation and so forth. So we also brought her to Poland to see what we could do for her. The surgical part is one part of caring for them in Ukraine, but then you have to sort of also think about what surrounds those surgeries, right? So wound care, the wounds that we see in Ukraine are really significant. They've got a lot of infection and so forth. So the wound care nurses that you see there, they're all from the States. They're American. We like to collaborate, Mark, just with Americans. So we take all of our American wound care nurses, and they are spectacular. There's nothing they can't do. So again, we spend a lot of time. Now, one of the things that was a little bit striking to us when we went on our last mission to Lviv is how much falls on the hands of the doctors. So, you know, there's so much wounds work that needs to be done, but the nurses are not even allowed to do it, and the doctor has to come and do all this complicated wounds. So, you know, trying to bring in other specialties like nurses so that we can expand this multidisciplinary care and work on that too is really good. The infections are terrible, so we have remote infectious disease doctors on the phone all the time. On the last mission, there was a wonderful young woman who's a pharmacist who's very well trained in infection control, and it was wonderful to get to know her on the team, and I'm hoping to bring her to Canada so we can continue to evolve the relationship. We brought a rehab doctor this time, a physiatrist, who's an expert in prosthetics as well to this, and she was very helpful. For most of the day when they were in the OR, she was with them in Unbroken, working in their prosthetics areas. She actually was the one who set up all the 3D printing for them at the beginning of the war, so this was the first time bringing her into Ukraine, which again was very helpful because she'd been doing Zoom with them like monthly for like years, and now we brought her in, and we told her she has to come back and she doesn't have a choice. So, and then the other thing to bring in is like some of our OT and physios. So we travel with them as well. And this is one of our occupational therapists who we call MacGyver, because she walks in with a frying pan and a bunch of plastic and creates a splint for absolutely everything. And again, she spent a lot of time as well with the Ukrainians, showing them how she would make these various splints and how to immobilize these wounds and joints. So we come with a pretty big team. It doesn't end when we leave. We stay in touch. So, you know, ongoing virtual follow-up continues. Invariably, something will happen. And it's often just to be a sounding board. Like, what would you do now? How would you address this after we have left? Some of them also, though, are medical complications that I manage after the fact, because we find out a lot of medical illnesses when they come for surgery, and then we find, oh my God, they've got severe hypertension, their creatinine is 200, like things that we may not have known if they didn't show up for surgery. So a lot of the virtual follow-up is actually then medical care as well. So I was just going to, hopefully this works. I just wanted to show you. This is one of the Canadian Ukraine Foundation. They're in the room with us. This is one of their promotional videos, but let's see, how are we going to make this go? It's going to work? Is it going somewhere? No, it's not going. It's here, but how are you going to share it from here? Boy, you guys got a lot of skills. I like it. Oh, she does? Okay. Yeah. What she's setting up here, this is just sort of one of many cases that. There we go.
I had the opportunity of meeting Sasha at the lowest point in his life, suffering from incredible trauma.
When we met Sasha, he was incredibly wounded, incredibly disabled, very debilitated, and really very angry, and understandably so.
Our approach to defects is exactly the same as it would be in approaching defects in patients after ablative cancer surgery or trauma surgery in Canada. Approaches are exactly the same. However, the magnitude of the injuries, the severity of damage to tissues is something that we would normally not see in a peaceful country.
To see him go from a stage where he needed so much help, I would say surgical help, yes, but also psychological support from the team, and to see him really be transformed over the course of years, that evolution, and in a degree that transformation has been just so reaffirming.
He went from a completely broken man to now he's almost a cheerleader for the whole Ukrainian missions.
As each mission went on, to actually watch probably what was his pre-war personality come back to life was really amazing, as we gave him the opportunity to, eat again, to speak again better. It was really an amazing journey with Sasha.
Helping Sasha has been the most rewarding thing I've ever done in my career. And I'm just so happy to see him be well.
In order to make this effective, in order to be able to continue this on a longer term and have a larger impact, we need donors. So we need people to contribute.
Я не знаю навіть всіх їх поіменно, і сказали режисеру за це. Але я так само не знаю навіть, як їм казати слово дякую, бо воно тобі навіть і не тікає.
You don't actually have to donate. That's just, I wanted to, the cuff made it, right? So I have to, but I want to show you the story. And the stories are really equally impressive. This is our orthopedic surgeon dancing with the woman whose legs he nailed, and she's still going to take a long time and a lot of rehabilitation. But again, it was just really lovely to see her up and walking. Is it going to go forward? Okay, so since 2014, between 2014 and before COVID started, 7 missions were done in Ukraine. Since that, we did 6 in Poland, 1 in Ukraine again, and 4 under the Sunnybrook in Ukraine. So we calculated out that it's over 1,000 patients that we've consulted on. Greater than 500 have received at least some kind of surgery from us. Oh, I'm going backwards, sorry guys. There we go. But doing the surgeries is just really a very small part of what we do and what the whole purpose of it is for medical education and to spend time with the surgeons in Ukraine. So over the time that, Dr. Antonishin's been there, he's interacted. We've done, because we do large symposiums and people will come. We do education in so many different ways. Like we'll hold a conference and you'll get 200-300 people coming to the conference, and then we'll do small group teaching, and we bring in cadavers, we bring in everything. We bring in microsurgery setups and little fracture things. So, and also we work with these hospitals to help modernize their equipment, because what we use, if it's donated, we leave it, right? So if we get a C-arm that we needed for ortho, we could leave that C-arm in Luke's or where we have been doing care. So these are just some of the pictures of all the Ukrainian surgeons that are learning with our physicians in the OR. So they get to do this in the OR, very hands-on. Like I said, we bring all kinds of teaching models. And because I'm an internist and I'm pushing my way into here, whether they like me or not, because I'm just forcing my way on them. 2 minutes. Okay, yeah, that's good. For you or for me? Oh, okay, sure. So just because I'm forcing my way on them, we're making sure we can have impact in other areas. So this, Dr. Amanda Mayo spoke in quality patient safety. I taught the nephrologist, so we had lots of opportunity. And we're bringing them back as well. They're doing full, this is Alexander Lopez. He was a first fellow. He came to do a full plastics fellowship in Winnipeg. And as you can see, I like him better than my own children because he spends a lot of time with us. Right now we have, a neurosurgeon, a neurologist, we have a plastic surgeon, an oncologist, and all these people are here with us. This is the team of Unbroken. For reasons I don't understand, they wanted to go up onto the helicopter pad. We thought it was a bit dangerous, but we got some really great pictures. So, these are the relationships that we are building now for the rest of our lives. So, and that's what's, I think, the most important is that we've met them, we know them now, we're there for them, and we can continue to be of service in the long run. So, thank you very much.